Now we'll be talking about an excellent drug which is tramadol. Tramadol is a very commonly used drug. We must know that this is a opioid drug. This is a synthesized opioid drug, and opioids are excellent analgesic as they act directly in the brain with opioid receptors. Now, as this is centrally acting, it acts in the brain. The half-life of this drug is around 5 to 6 hours. So, the effect of this medicine usually lasts for around 6 hours. That is the reason it is mostly given 3 times a day. But if pain is more, depending on the severity of the pain, it can be given 3 to 4 times a day as well. It is very common drug which is very commonly available in oral as well as which is extensively used for intravenous use also. Very commonly Tramadol, Altracet, these are the medicine which contains usually 37.5 milligrams of tramadol with 325 milligrams of paracetamol as well. Such tablets can be given 3 to 4 times a day to alleviate the pain. Whereas intravenously, this comes in 50 milligram preparation. So 50 to 100 milligram of this IV tramadol can be given 6 to 8 hourly, depending on pain. What are the problems with the tramadol? Tramadol should be always given. If it is given IV, then it should be dissolved in 100 ml NS, and it should be given over a period of at least 20 to 30 minutes. It should not be pushed rapidly because it can cause tachycardia, palpitations. The the problem with tramadol is it can cause nausea, it can cause vomiting. This is a very limiting side effect of this medicine because this most of the patients, like suppose post-operative patients, can already have nausea because of this anesthetic drug effects. That is the reason why this tramadol can be a problem. It can increase the nausea and vomiting. It can very commonly cause constipation as it is one of the opioid drug and opioids do cause constipation. Dizziness and sleepiness can be caused. Patient may feel drowsy or sleepy after giving tramadol, which may be beneficial for a patient with so much of pain or which may be a problematic issue in a young patient because these patients may complain that our patient is very much drowsy. But it can definitely be a very good option for pain. The hemodynamic effects of these medicines are minimal. That is the reason why it is stable. It won't cause fluctuations in blood pressure or RR or saturation. So this is good. And any type of pain is very well evaluated, very well alleviated by this medicine. It can be neuropathy, it can be muscle pain, it can be joint pain, it can be headache, it can be road traffic accident, it can be bone injury, sport injury, any type of injury. It can be post-operative pain. This tramadol gives excellent relief in the pain. It can be headache, back pain, heel pain, chest pain, as it can cause this acidity, nausea. That is the reason why it should not be ideally used in severe gastritis, where the patient already has this nausea, vomiting. And if the patient is elderly, if patient has problem with constipation, or if you suspect the patient has bloating, indigestion, gases, then in such patients also tramadol should not be used. Otherwise, it can also increase the constipation, and constipation very commonly increase bloating, very commonly increase gases, very commonly increase the nausea, and in elderly patient, it may be very irritating for the patient to bear these symptoms. So, in these patients, this tramadol should be avoided. Very commonly, Tramazac, Ultracet are very famous, very renowned brands, which comes in tablet form with 37.5 milligram of tramadol plus 325 milligram of PCM, and injectables. They're very commonly found or present in 50 milligram to 100 milligram IV formulation. So that's all. Thank you.